Many Americans enrolled in Medicare have multiple chronic diseases. But unlike millions who have private insurance, they don't have access to proven support programs, such as disease management. Without this critical support, every day is a struggle just to get through.
It's one thing, bad thing about getting old. All your relatives and friends are gone.
Harry is a decorated veteran of World War II. He is now battling coronary artery disease, heart failure, and diabetes. His wife has passed away, and Harry is now alone.
When I wake up, before I get dressed, I take my weight. Then I have to put eye drops in my one eye. The right eye I can't see out of that at all. And then I take my medication. I take about 7 pills a day.
I always thought I was getting ready to die because my family died early.
After raising 10 children, 6 of her own and 4 adopted, Eva now struggles to manage many debilitating illnesses, including respiratory disease, diabetes, heart failure, and coronary artery disease.
So if you don't take your high blood pressure medicine, you could get a stroke. If you don't monitor your insulin, if you take your insulin and your sugar is too low, you could go into hypoglycemic.
Antoine is a former EMT. After dedicating his life to saving others, at 51 years old, he struggles with multiple illnesses and lives in constant pain.
I have arthritis from my neck all the way through my spine. I have arthritis in my hips, my knees, my ankles from various injuries over the years. I've had 4 heart attacks, 4 strokes. I have hypertension. I have heart problems. I have vascular problems with my legs that has required surgery on one leg so far.
Saul is a veteran of the Korean War and has been fighting diabetes for more than 40 years. He also has cardiac and respiratory disease.
Here recently, as a result of my diabetes, I've been diagnosed with a kidney problem. And I'm now operating at about 50% capacity.
Doris was born with muscular dystrophy and often relies on a wheelchair. She has survived cancer and a heart transplant.
I've had cancer, breast cancer, and of course the breast cancer medicines unfortunately ruined my heart, and so now I have a heart transplant. The heart medicines I had to be on killed my pancreas, so now I have type 1 diabetes.
For many, the diagnosis of a serious illness is overwhelming. Unable to cope, they withdraw into hopelessness and solitude.
Anybody who has severe medical problems deals with depression in one form or another. I myself have run that gamut, from the point of where, well, I think I'll just stay inside today and let the world go by, to the point of where I have thought of suicide.
These 5 people, like millions enrolled in Medicare, have multiple diseases. While some are neglected and medically underserved, others struggle to follow care plans from an average of 11 doctors while taking as many as 18 daily medications. After a lifetime of caring for others, they are now completely alone. America's mothers, fathers, our husbands, wives, our heroes. Now that they are frail and suffering with disease, who can give them the kind of support they need? The answer is Medicare health support. Through Medicare health support, experienced nurses, dietitians, and social workers contact Medicare beneficiaries who have heart failure, complex diabetes, or both. Medicare health support helps monitor and manage their conditions while communicating with doctors and caregivers. It also helps connect participants with local organizations that can provide other needed services. Medicare health support is a program that is making a difference.
I think this program gives doctors, patients, and the nurses at the call center to really, for the first time, join hands and together see that each patient gets the best health care possible.
I think the program definitely has empowered patients to feel better about themselves and empowered them to take on more of their own health care. And the more involved they get in their health care, the more they're aware that what they're doing is benefiting them in the long run.
We know if we do nothing, that the future will be ominous and as dark as many economists forecast. The Medicare Health Support Project is showing many alternatives to being able to empower the consumer to improve the quality of life and indeed improve quality health outcomes. This is a policy innovation that we have good data on that actually works.
It has kept me out of the hospital. It has certainly avoided any emergency problems that I may have had with possible dehydrations and other things that are so characteristic of diabetes.
Don is my nurse. Right now, when I talk to them, I feel great. I feel like a new person. Donna feels like a sister to me. She's very helpful.
The program to me has been very successful, not only as a support group, but answers a lot of my questions and that I might have that even the doctors don't answer.
For these beneficiaries and thousands of others, Medicare health support is more than a program. It is a lifeline, a connection back into the world. It is a connection between their doctors and their medications and how those impact their health. It is a connection to what they can do to empower themselves and find hope.
The day is coming where I'm going to be confined to a wheelchair, but I'm fighting that as much as I can. The program is one of these examples where you find something that works and you pray that it continues.
In 2008, this pilot program will end. If allowed to end, this critical lifeline to thousands of chronically ill individuals will be cut. They will descend once more into hopelessness. Can we really abandon them?